This is the fourth and I believe final installment in my large intestine bacterial overgrowth mini-series. And in this video, I'm going to talk about the treatment options for treating for addressing LIBO. As per usual, nothing that I say should be construed as medical advice. Before making any health decisions for yourself, please talk to your personal health provider. So when it comes to treating large intestine bacterial overgrowth, what I found in my practice is that there are certain therapies that are much more consistently helpful to get rid of LIBO than others. Now, I've seen all manner of antimicrobial natural products work to treat LIBO. I'm really not aware of what types of pharmaceuticals might be helpful to treat LIBO. I don't prescribe those in my practice, and I haven't seen any research literature, nor have I heard any clinicians talk about antibiotics that they use to treat LIBO. So that's something I'm just really not sure about. If you know about that, I'd be happy to learn more about it. Please post in the comment section below. Be curious to know about that, but haven't heard anything so far. But in terms of natural agents, and typically they're herbal agents, whether it's things like oregano essential oil or berberine or neem or some of the other natural compounds that people use to treat SIBO, sometimes those agents do seem to get rid of LIBO too. And so that's great. Whatever works, works. But I've had, as I've been indicating in the previous videos, have had a number of patients where they're treated for SIBO, but their symptoms are persisting or not fully getting better or relapsing or whatnot, and it's because of a LIBO thing. So those agents that are good at treating the SIBO do not work for every case by any stretch. So the type of treatments that I find to be the most effective for LIBO are taking herbs in a dried, powdered, or just sort of in like a dried leaf form. The things that I found to be not as helpful would include essential oils and tinctures when it comes to treating LIBO. And my theory behind that is because I believe, and to my understanding, tinctures and the antimicrobial components of tinctures and essential oils are going to be quite likely to get absorbed systemically into the bloodstream when they're in the small intestine, and not necessarily make it all the way to the end of the large intestine, which LIBO can exist throughout the large intestine. When we do stool testing and get evidence that there is LIBO, that stool is coming from the end of the large intestine. So we, in my opinion, definitely want to make sure the herbs are actually going to get there. Herbs in a dried, kind of chopped up form, like in a leaf form, or roots or whatever it happens to be, or in a powdered form, I found to be more consistently helpful. And I think it's because they're not nearly as well absorbed going through the intestinal tract as tinctures or essential oils. So what I found is that herbs, even the exact same herb in like a dried and chopped up form in a capsule, that the exact same herb in a tincture might not work, but in a capsule it does work. So for example, there might be a formula with, say, wormwood and black walnut in it that didn't really fit the bill or didn't really knock it out of the park in a tincture form, but in an encapsulated dried herbal form, it worked really well. So it's not a very complicated variable to make sure, or to do our best to ensure that a LIBO treatment is going to be helpful, but it does seem to be those types of protocols that involve those dried or powdered herbs do seem to work a heck of a lot better than other forms of herbs, in my experience at least. So in addition to using the right herbs in the right form, it's also generally almost always important to make sure that we're working with the right type of diet. Anti-SIBO diet and anti-LIBO diet tend to overlap a whole heck of a lot. So oftentimes the patients, if they've been dealing with SIBO and are still not 100% better, we typically just stick with the same diet. We just switch up the herbs or other antimicrobials that they might be working with. So the LIBO topic is quite broad and vast. I've just tried to touch on it with the last few videos. So I'll leave it there for now. If there's any outstanding questions about this, please don't hesitate to post in the comment section below. I'll do my best to answer. And otherwise, I will leave it there for now.